Hi, I'm Steve Anderson. I'm the President and Chief Executive Officer of the National Association of Chain Drugstores, and I'm speaking to you from Boston, Massachusetts. We're here for the NACDS 41st Annual Pharmacy and Technology Conference, and it's really going amazingly well, and I think it really embodies what community pharmacy is all about. Community pharmacy touches the lives of more people than just the people that come into our stores to get their prescriptions filled, which is obviously very, very important. But community pharmacy has about $700 billion in sales in any given year. More than 3 million people work in this industry, which is extraordinary. We have a payroll of $68 billion. So we touch the lives of a lot of Americans. But one thing that's really interesting, I think, is that we have a community pharmacy store on average about 1.6 miles from every home in America. And what that means is that community pharmacy really is at the center of the local community, but even more importantly, we're at the center of the nation's economy. And we have a huge impact on the healthcare system in this country. But we need to tell that story a lot better, and I think that's why it's just a terrific opportunity to be here with Drugstore News TV to talk a little bit about what the community pharmacy industry is doing in their trade association, the National Association of Chain Drugstores. Not only are our members improving lives, but in fact we're saving lives. We're involved in some major battles right now on behalf of community pharmacy. The biggest one that we have right now are reimbursement rates for Medicaid, and to make sure that the community pharmacies are being reimbursed at rates that are appropriate and similar to what they're getting the product from the pharmaceutical companies. The Centers for Medicare and Medicaid Services has introduced a final rule as part of a rulemaking process to implement the Deficit Reduction Act that would require the government to reimburse pharmacies far below the costs that they're experiencing when they buy the product. And that has put in threat community pharmacists around the country, but particularly the Medicaid patients that we serve. Another issue that we're involved in is TRICARE and making sure that our heroes that we have in this country, our military, the military families, and our veterans have access to community pharmacies, and to make sure that if they want to have their prescriptions filled in retail pharmacy as opposed to mail order, they can do that. And at the same time, we're saving the federal government money through that program, about $1.8 billion over a 4-year period of time. So it's pro-savings and pro-soldier, and we think that's very important. We're also involved in Medicare Part D. When the Medicare Modernization Act passed Congress and was signed into law by President Bush, a major part of that was the Medicare Part D program, where in fact we can head off disease and chronic illnesses and save healthcare dollars in terms of emergency room visits and doctor visits by using medicine from a preventative standpoint. But once again, that shows the value that community pharmacy has in this country. When people had questions about Medicare Part D and what plans that they should be on based on the medications they're taking, they turned to the community pharmacists. We've got a lot of issues that we're facing. I would encourage you, if you want to know more about NACDS, to go to our website, NACDS.org. We need the help of everybody that is involved in this industry. So I really want to thank you for the opportunity to be here. We have a very close relationship with Drugstore News and Drugstore News TV, and it would encourage you to go to our website, NACDS.org, if you want to learn more about community pharmacy and what the association is doing on behalf of the industry. Thank you.